Okay. You guys didn't mention me to record the session, but it's okay. Um, so again, a 45-year-old Jehovah Witness with massive gastrointestinal bleeding refuses the blood transfusion despite understanding that refusal may result in death. So what is the most appropriate management? Here, give them blood because the situation is life-threatening, or obtain consent from the patient wife, or respect the patient refusal after confirming decision-making capacity, or apply to the court for permission to transfuse immediately. Here we go with this option C because the competent adults have the legal right to refuse any medical treatment, right? So including life-saving treatment, the doctor should confirm capacity, ensure the decision is informed, discuss the alternative where possible, and the document of the discussion should carefully be noted. So here we have to respect the patient refusal. Okay. Administer blood, why not? Treating against the competent patient is unlawful. Wife's consent relative cannot override a decision. Court order generally unnecessary when a competent adult refuses treatment. You can't do anything. They have fully right about their life. So first, capacity with informed refusal, respect the patient decision. That's it. So for the child case, we say that we have to check the Gillick competence, right? Here, if the child is less than 18-year-old, right? If there is a life-saving blood transfusion, or if they are Jehovah Witness, so the best answer for this case, like if they are refusing consent, we have to give the life-saving blood transfusion. Because don't delay the emergency treatment here because they are under like age of 18 and there is a risk of life threatening, right? But yes, parents can refuse treatment only if the refusal does not place the child in serious risk of harm or death. When the refusal is likely to result of death, permanently disability, or serious of harm, so the child best interest override parental wishes. So we have to protect the child. We can't ignore the parents' objection. No matter what, if there is life threatening in the child, we have to immediately resuscitate patient or transfuse the blood. All right. In the case of pertussis vaccination, guys, there was an option of like the parents, the let's say the parents are refusing the vaccination. So it is up to you to see to make this decision if the child is in the risk of harm and life is under threatening. So in this case, you have to inform the CPS. If you see the child is not in harm or life threatening, then you can only notify the public health unit. So one liner, if there is an adult and Jehovah Witness, and if they are refusing the blood, you have to respect the refusal. Okay? If they are competent and adult. If it is a child and the parents refuse life-saving blood, you should transfuse the blood for the patient for the best interest. If the child is came in the emergency, or even if it is adult and they're conscious, treat first. Do not delay to obtain the court order. And if there is a Glick competence minor refusing the life-saving blood, so this way you have to urgently take a legal advice. Like the court can override the refusal. The court only can override this refusal because in the case of Glick competent minor. Yes, the parents can refuse any vaccination unless if it is serious of harm or put the babies in the risk, then you have to. I searched this case a lot and I found that the doctors can respective parents only in the case if the child is not at risk. First, explain for them, yes, the advantage, disadvantages, and if it's still not convinced, then see if the child is under risk, then you have to. Right, so let's do this question. Is leaving hospital against the medical service? This is also medical advice. This is also a repeated recall. A 56-year-old man with a severe community-acquired pneumonia wishes to leave the hospital despite medical advice recommending admission. What is the most appropriate next step? Prevent him from leaving, or assess his decision-making capacity, or explain the risk and document the discussion. Call the police or discharge him without discussion. So definitely decision-making capacity first. And a one-liner, offer treatment, follow-up, safety, net advice. Leaving against the medical advice does not mean abandoning the patient. The summarization, for substitute decision maker, follow the legal hierarchy after confirming the patient lack capacity. Advanced Care Directive, a valid directive must be followed and cannot override by family. Advanced Care Directive unavailable. In emergency cases, commence necessary treatment urgently. If there is a refusal of treatment, a competent adult can refuse and you have to respect, including life-saving treatment. Leaving against medical advice, you have to check the capacity. Okay, so this was part 3 and now part 4. In part 4, the first is assess the medical record. This 45-year-old man requests a complete copy of medical record of his general from his GP. This 45-year-old man requests a complete copy of his medical record from GP. What is the most appropriate response? Refuse because the record belongs to the practice. Provide only pathology. Arrange an appropriate access to medical record in accordance with privacy legislation. Or advise him that only another doctor can request the record. This is the best answer here because patients generally have the right to their health information. Although the physical medical record belonging to practice hospital information wherein it belongs to the patient. Access should be provided in accordance with the privacy legislation unless the lawful exception applies. Okay, so in this case, we have to, refer them to their clinical information. Now, breaking bad news, a 70-year-old man is diagnosed with metastatic pancreas cancer. Before you speak to him, his family asks you to not tell him the diagnosis because they believe that he will lose hope. What is the most appropriate next step? Respect family request. Tell the family only. Ask the patient how much information he wishes to receive. Delay discussion. Here, the patient has the right to know anything about their health, so we have to ask the patient. So they wish to receive about their health. Some patients prefer full disclosure, while others chooses to receive limited information, nominated family member. The doctor is responsible to determine the patient wishes. Okay. Now, conscientious objection. In this case, a woman requests a referral for termination of pregnancy. The GP has a personal conscientious objection to abortion. So what is the most appropriate management? Refuse to help and end the consultation, explain the personal objection and arrange timely referral to another appropriate practitioner. Tell the patient to abortion is unethical or delay the referral to encourage. So definitely if you are a GP and you don't want, first tell your reason and then arrange and tell the patient to see another appropriate practitioner. So you have this right to ignore, to do whatever you don't want. The doctor may have conscientious objection. However, professional responsibility requires that they communicate respectfully, avoid imposing personal belief, and ensure the patient can access appropriate care without unnecessary delay. Refuse to help is not correct because this may constitute patient abandonment. And tell the patient abortion is unethical. Personal beliefs should not interfere with professional care. Delay referral is also unacceptable. So the doctor may decline to provide certain treatment, but they may not obstruct access to lawful healthcare. No, why tell the patient abortion unethical? This, like, they have right to. Next question. A GP begins a romantic relationship with patient who is still receiving ongoing care. What is the most appropriate statement? It represents a breach of professional boundaries. That's correct because we have read the full option to mandatory informing of APRA. Okay, so the next question, guys, is social media and patient's confidentiality. For gender transformation, yes, that's also can apply. As I said, if the GP don't want to provide treatment as per their conscientious objection, they can explain to the patient their reason and advise the patient to see another GP. Very simple. Which that is not against the law. You are not refusing the patient to not do. You are not saying the patient that it is unethical because you shouldn't apply your personal belief on the professional systems. Social media doctors, a doctor posts a clinical photograph of unusual skin condition on social media after removing the patient name. The patient face is partially visible. What is the most appropriate statement? The post is acceptable because patient name was removed. The post is acceptable because it is educational. The doctor should obtain the patient consent before posting identifiable clinical material or consultant approval is exception. This is obviously, see, definitely we have to take the consent anytime if you want to share any information of the patient, whether it is photo or medical information, anything. So summary, access to medical record. The patient has right to their medical record. Breaking bad news, you have to ask the patient what you want to know. Conscientious objection, respectfully explain your objection and then refer them to the another practitioner. Professional boundaries, romantic or sexual relation is inappropriate. And social media is also, you have to take the consent from the patient. Now, part 6, gift from the patient. This is a patient gives her surgeon an expensive luxury watch after a successful operation as a gesture of appreciation. What is the most appropriate response? Accept a gift, and it is a token of gratitude. Accept a gift privately and document it later. Politely decline the gift or manage it accordingly to institutional policy. Accept a gift because refusing may offend the patient. So if it is other countries, definitely they will accept the gift. Here, you have to politely decline it because this doctor should avoid accepting expensive gifts because create a conflict of interest, influence professional judgment, create an obligation toward the patient, undermine public trust. Small token of appreciation. Thank you card, inexpensive chocolates are generally acceptable, but expensive personal gifts should be usually declined. Here, there is some other question, guys, about this, not about the patient, but you're saying, for example, a company of the pharmaceutical, they want to provide a free complimentary hotel reservation and like travel expenses for a doctor. Or there was, I recall, last year they came and say that they will provide a complimentary lunch for the medical practice, just because they advertise their brochures of their company. That was some pharmacy company. They provided some medication. And that way they ask like, what will you do? Will you accept it or will you not accept it? So will you decline? What will you do? Okay, so we can accept this only in the case which is there is no conflict of interest. No conflict of interest means if you accept this as a gift from that company, definitely they will expect you to always write their medication, right? So it shouldn't be like that for advertisement or for to write their medications anytime. So this is creating a conflict of interest. This way, the options was to not accept it because here in the hospital, I am providing uh, like managing the trips for the specialists who they are going for the conferences. So there is some conferences they are providing free registration of the conference and the round trip of the flights. And so what happened here? The doctors are accepted that. So the flight tickets are sponsored, the fees of registration is sponsored, and the doctors is going there for presentation. So here in New South Wales, they are accepting because the doctor will write a form of conflict of interest, and they will write everything minutes by minutes why they are going there and what is the benefits for the like for the New South Wales hospital. If there is a benefits for the hospital for the Australian health sector, so there is no any objection, no any illegal way to not accept it. They accept it. So even they provide the registration, the complimentary hotel reservation, and the flight tickets. Without any issue, they go and they are coming back. So because you know why? Because that trip is providing for them because they are going from the hospital as a representative. It is not a personal travel. Or if they're providing you a holiday flight, that will be a conflict of interest. But this is not a conflict of interest. They are providing this just only because of you are working at the hospital and they are inviting you as a guest. Okay. So there is lots of thing, and here we should not. Everything is personal. Don't accept it, and it is conflict of interest. And for the lunch, which I said, that is providing for medical practice. This means not only for you, for all the medical practice. And see in the STEM, every mention that they are after to encourage you to write down their medications. So don't accept it. If it is only for general help or just to provide a lunch for all the staff of the medical practice to have a good relation between the pharmacy and the medical practice, that's okay. Because every time the companies are providing lunch in the hospital, they are bringing a lot of lunch, dessert, anytime. There is nothing for the food is no objection, nothing, no problem. But if there is some expensive gift, personal gifts, it is conflict of interest. Understood? Yeah. Now, self-prescribing. Self-prescribing, you have seen last month, a doctor develops severe back pain and writes a prescription for oxycodone for himself. What is the most appropriate statement? Self-prescribing is acceptable. Self-prescribing controlled drug is appropriate. Doctors should avoid prescribing for themselves except in exceptional circumstances. So the doctor should generally avoid prescribing for themselves or close family because clinical judgment may be impaired, objectivity is reduced, important diagnosis may be missed, and appropriate follow-up is less likely. So this is particularly important for opioid, benzodiazepine, stimulants, or psychotropic medication. Here, I am not sure about this exceptional circumstances. This I'm not sure, but to go advise them to go for the GP is the right answer. There was an option of that, but here there is no option of that. So here accept the doctor is not correct. Control drugs is appropriate is not correct because makes put them in a high risk of misuse. And from another doctor afterward, where is it? It is acceptable. Retrospective notification does not make an appropriate prescribing acceptable. Avoid self-prescribing, prescribing for family whenever possible. So they can go to the GP, but they cannot prescribe for themselves, or neither they can prescribe for their family. There was another, I hope this is the pharmaceutical sponsorship. I hope this is my question. A pharmaceutical company offer a doctor an overseas conference, including flight, accommodation, exchange of promoting one of its medication. What is the most appropriate response? Accepted because continue education. Accept if the medication is ineffective. Decline because it's create a conflict of interest. Because they are saying here promoting one of its medication, right? So they are after some benefits. If they are after benefits, then you have to ignore it. Okay? And doctors should be avoid arrangement that may influence and appear to influence their prescribing behavior. Clinical decision must be always be based evidence, patient benefits, and clinical judgment. Do not on financial or commercial incentives. So again, I am saying if they are after any benefits, the company just is rejected. If they are not after any benefits, just to support and to help, then it is acceptable. Conflict of interest, like they all want to promote their medications. They want you to write always their medication. Like they want you to support them. Okay. And so for this question, for the GP, there was another scenario as came as a wife and husband has a GP, a regular GP. So the GP has been invited to their uh, annual anniversary, and the GP became their friends. So now the wife has came back to the GP and want to discuss something about their relationship with her husband. What is your advice? So the options was given that politely refuse to give them a treatment or advice, ask them to go and see another GP. Yes. Now you are part of their relation. I mean, you are now their friends. So you know mostly all everything about them. So now you are not allowed to treat them as a GP. In this case is also matching this, like you are not allowed to treat your family or neither you are allowed to treat yourself because you know all your family members and you are not allowed to know about their um, medical history or about their background of medical medicines. So you have to refer them to another GP. Pharmaceutical is done. Advertising. A specialist advertises by stating our services best surgeons with guaranteed results. Which statement is most appropriate? This is acceptable marketing. This is acceptable if previous patients agree. This is misleading professional advertising, and this is acceptable because the surgeon is experienced. If single GP in the town, that I don't know. That is very, like, put me in a very risky situation. You guys are better to become like a movie producer. You know, very good scenarios and to making different complicated scenarios. Okay. So in this case, yes, this is a misleading professional advertising. So you should be very clear and professionally and to be true. So medical advertising should be truthful, factual, evidence-based, not misleading. Doctors should not claim superiority, guarantee outcomes, exaggerated success rates, and create unrealistic expectation. This is what the paid groups are doing it. They are claiming they are very superior. They are claiming that their success is 100%. It shouldn't be like that. It should be truthful, factual, evidence based on, like, it should be evidence based. Like us, we have a lot of evidence. We are not misleading, and this is not accepted in Australia. In Germany, you're not even allowed to advertise. Okay. Um, yeah, okay. That's new for me. Okay, so here doctors can advertise but not exaggerate. You can advertise, you can say like what the facility the hospital has, or what subspecialty the hospital has, like what kind of procedure you can do. That is okay based on the evidence, but not something exceptional like they are the best surgeon. There's a lot of best surgeons in United States, in India, or in Pakistan. Okay, so next question. A patient is declared brain dead following severe traumatic brain injury. The family is uncertain about the organ donation. What is the most appropriate next step? Proceed with organ retrieval because brain death has been confirmed. Discuss organ donation sensitivity with the family according to the local organ donation procedure, or ask another family member to decide or delay all discussion until after burial arrangement. So here, once the brain death is confirmed, according to accepted medical criteria, organ donation should be discussed respectfully and in accordance with Australian organ donation process. So the discussion should be conducted by appropriately trained staff. Why not proceed immediately? Consent and legal process must be followed. These other options are not making sense. Okay, so this, I believe something is lacking in this recall. So, but out of other options, this is the right answer. Discuss organ donation sensitively about the family according to the local organ donation procedures. There was another question about the same scenario. So the patient was brain dead in the hospital, and it was the fault of the hospital, which, for example, sorry, this is a live case, which this is a live scenario which I have seen in Australia. One of my friend, a wife was pregnant, and she went to the hospital. And she went to the hospital, and then in a week of 39, and she was the all vitals was normal, and so the patient went for the normal vaginal delivery, and she was in the labor. So the midwife came, and the midwife was heard the baby's heart sound by handheld Doppler, and it was noticeable. And then the midwife said, "Okay, I'm coming back in 10 minutes." So after 10 minutes, the midwife came, heard the baby heart was very weak. And the midwife was not sure, is that the baby heart sounds or is that the mother's heart sound? And then the midwife said, okay, I'm coming back at 10 minutes. So after 10 minutes, this lady, pregnant lady friends came and they had some chatting and the midwife came and see they are busy. And the midwife came after more 10 minutes, like after 20 minutes. Once after 20 minutes, she came, she heard there is no heart sounds of the baby. And then she pushed the buzzer. So they immediately rushed to the emergency and they did an emergency C-section. So the baby was brain dead. The baby was, yeah, the brain was edematous. And they called me. I went and I checked. I'm not working as a doctor here. I went as a friend of them. As a friend of them, because I knew some, the knowledge of medicines. So I went and I checked all the cases, and I was so sad. So this happened by the hospital, not by the patient. It was fault of the hospital. So they arranged the conversation with the medical director of the hospital, and I spoke with the medical director of hospital, like why you guys didn't use CTG, because you knew if the patient heart sound is weak, so you have to put a CTG and then find out to control very well why this happened. And then he said, "Oh, I know it is our mistake, but I will investigate this." So um, we are not using CTG as always. That is right. They can't use CTG always because CTG is only in the condition if the mother had a complicated delivery previously, or if there is any maternal risk factor like high blood pressure or heavy weight or the baby compromised. So in this case, so he investigated. It's been like a month past, and the baby was in ICU, and the hospital pushed my friends and friend's wife to take out the baby from the nasal tube because the baby was in the nasal under resuscitation in ICU. So they say that the baby will not be survive anymore. So it's waste of time in the ICU because we have a lots of patients to be look after. So my friends ignored it. My friends said, no, I want my baby to be under machines and because we have this right. So this hospital approached to the court and they took medical advice, legal advice, everything is done. So the baby was in the hospital for 6 months. There was no improvement, but the baby became so big. The baby couldn't see and not movements. Just a big movement was there. And finally, the best thing is like I was part of their meeting, and the best thing is like I found a very two, three different reports. The first report says brain dead. The brain dead was they have written uh, 2 days after the delivery. And after, once my friend said, I don't accept this is the hospital fault, then they bring another neonatologist from another hospital to come and see the patient's condition. That neonatologist report that this patient is not brain dead, but the patient has some edema in the brain or something, blah blah. So finally, I found this two different reporting and I said, okay, why these two reporting are different? How you will make sure that this patient is brain dead? You already told the patient is brain dead, meanwhile the patient was not brain dead. So finally our purpose was to keep the patient in the ICU. But finally the court ordered to take out all the tubes because it's not the patient will not be get better. And I told my friends that is waste of time, just leave it to go. But my friend and his wife was very upset. They said no, the hospital has to pay for it because my baby doesn't have any problem. Anyway, I don't longer this discussion. So this is the case happened, and then finally, like the parents couldn't do anything. The court decided to take off everything, and then yeah, the case is closed. So I said this because here in the hospitals also happening some cases which is not professionally taking care of the patient sometimes. Yeah, totally negligence. Right. I agree. That's why when I read this part of, where was it? That you, where was it? This part of education, like we are the best, that is not right. Sometimes they're also doing some mistakes. So medicine is not about to be perfect. There is a lot of mistakes. No, they easily, yeah. No, here they release it, so they close the case, and it's